We did a lot of work on lactating cows, but now it's more on prior to calving. Because the manifestation of mycotoxin look like it's other problem, but not mycotoxin. And the issue is that mycotoxin are pro-inflammatory and has the potential to trigger labor earlier.
Interaction of mycotoxins and gestation length with health and survival of dairy cows and calves. That is the topic I'm going to discuss in this episode of Future Feed Talks. In the hot seat, we have Gustavo Schuenemann, a professor of dairy cattle health and management from Ohio State University. My name is Marieke Ploegmakers. I'm the editor of All About Feed, and this series is in cooperation with DSM-Firmenich Animal Nutrition and Health. So hi, welcome. Happy to have you here, Gustavo. And we talk about mycotoxins today. So tell me, what is the relation between mycotoxins and gestation length of dairy cows?
So specific on mycotoxin and gestation length, that is a great question. And mycotoxins are, in general, pro-inflammatory, right? So gestation length, in particular at the end of the gestation, so the last, I would say, 30 to 45 or 50, they are very sensitive to any pro-inflammatory stimulation, right? So what we think and what we are working now is that mycotoxin trigger labor. So it means that the cow, most Holstein cows, we have 279 days gestation length average. But what we see is that the cow can go in labor about 7-10 days earlier when they are, exposed to contaminated TMR with mycotoxin. And we know that short gestation, it's a problem for both, for the cow and the calf. So what is difficult for farmers is that they see the problem but don't necessarily associate with mycotoxin. That is why we start working on mycotoxin, but prior to calving, not during lactation. Right.
Okay, and so I can imagine it also has the impact on the calf in the end. So what is the impact then?
Okay, yeah, this is another great question. So, like anything in biology, you are set to have a specific gestation length. Each individual has a gestation length. In cattle, same in humans, and the sire, right, has a significant weight on gestation length. Right. Okay. So what happened is in Holstein cows, we have a range of gestation length from 255 days to 298, right? Average is about 279. So all these baby calves that are born from this short gestation, they always are the bulk of the problem, right? They have more diarrhea, more mortality, the mom has less colostrum volume, and they have early in lactation more health problems. So we know by research and science that cows that have short gestation, let's say 255 to 269, that is the bulk of the problem. We expect to have about 8 to 12% of the cows that have short gestation. The issue is, in particular farm, when they have more, like 18, 25, or even 30% short gestation. That is absolutely abnormal. Right? And we think that what is triggering that is this contaminated TMR with mycotoxin. That brings problem to both the cow and the calf.
But mostly then impacting also the immune system of the calf.
And for some reason, remember that who trigger labor under normal gestation is always the baby calf. So the baby calf is mature, is telling the mom, releases cortisol, which is an inflammatory process. So, and that triggers labor in the cow. But what happened is now the mycotoxin is causing the issue earlier than the calf is prepared. Right? Prepared to come out.
So the calf is not ready yet.
But it's very difficult in the farm condition to pinpoint this problem because you never associate with mycotoxin. Right? So that is one of the reasons why we see the problems after parturition. Now we come in the prepartum pen and start looking at for mycotoxin, especially for the prepartum cows.
Okay. And we talk about mycotoxins, but is it like one mycotoxin that is causing this, or it's a combination, or?
That
Did you
is
look
an
at that?
excellent question, Mary. It's usually a combination of almost always, I would say, a combination of mycotoxin. And, different than the swine or different than the poultry and ruminant, we use a combination of ingredients, right?
Yeah. Yeah.
The forages is the bulk, but also byproduct. And byproduct, we have seen the different mycotoxins. For example, in forages, the most common for us and globally is, DON or mycotoxins. And but in byproduct, it could be, cereulonone or others. So what we see when we did the epidemiology is that we are dealing with at least 4 mycotoxins.
Okay.
And we have different risk level, right? But it's a combination of mycotoxins what trigger the issue. And there is very little, there is more research coming out. We don't know if, adding 2 mycotoxins has an additive effect or a multiplicative effect, right? But what we do know is that at least we are dealing with 4. 4 of the ones we know.
Yeah,
There's a number of other mycotoxins we don't even know. And
it's the combination.
It's the combination what trigger. And specifically on the feeding management in our farm, it could come from the forage, especially from the field, especially when they have water issues like shortage of water, a limitation that then the plant gets stressed and that's how they develop the mycotoxin, or by storage.
Okay.
And by storage, especially in our system, and here in Europe it's the same, especially on the larger farm, they feed a little bit, wheat straw, and then if they don't store properly the wheat straw from the harvest, especially in the winter, they collect mycotoxin there as well.
And what about the levels? Like we have certain guidelines, but is even maybe I can imagine when there are also low levels, maybe it also have an impact.
Yeah, usually we manage risk, right? There are some low risk level of mycotoxin and there is a combination of mycotoxin. There are different guidelines on this. Think about this. When it comes to the regulatory side, right? Let's say aflatoxin. Aflatoxin, and I'm glad that it's the easy one to control. Right, it's easy, and we deal with that mycotoxin, but it's from the regulatory side, it's highly controlled in milk, so but it's easy to control, right? And usually the regulatory aspect, they are looking for things that cause either mortality or more clear cut. At the farm level, I'm looking for different things. I'm looking for things that cause subclinical problems. Right, so our level is much lower than the regulatory level, but it's either low risk, in PPBs or ppm, and medium risk or high. The example that I provided to you earlier, when it has 4 or 5 mycotoxin, is sometimes we have high concentration of DON, for example, over 1,000 ppbs. And the other one, fumonisin, could be the other one, also in high concentration, and then one on medium, and the next one on high concentration, cereulonone or ochratoxin, right? So then that is what caused the problem. And it's rather, you find it about 25% of the forages do have mycotoxin. If you look at epidemiology, globally, is 1/4 you have mycotoxin. But there are particular years that it could go to 75%, right? Like 2022 was one of those years, right? And there is, for the farmers, since it's an open sky business, they could do a lot of prevention in the field, but when they have this low, water and stress, the plant, they develop the mycotoxin, then the management began at the farm level using some of these additives.
So let's talk about that. What can a farmer do to prevent it? Because I think that's the main thing you have to prevent, or what can you do as a farmer?
Yeah, that is a great question when it comes to the farm, Marieke, fixing the problem. There are very few things that a farmer can change. Definitely they can change the nutrition, right? And so what we see at the farm level, they do the corn silage once a year. Yeah. And this is what you get, right? If you get a good corn silage, what I see farmers when they succeed, the best farmers globally, here in Europe, North America, South America, or even Asia. There is no good farmer, dairy farmer, that is not a good crop farmer, right?
Yeah.
So they are good crop farmer, right? So meaning they know how to get the forage, right? They manage the transition, they have good replacement heifers, and absolute quality forage, and they're good on people, right? When it comes to the forage, they do once a year most of the forage, except, right? So the year that they have the absolute quality usually is not a problem. Unless that you have some byproduct, let's say the stiller grains that come with really, really high concentration, you manage inclusion, right? So you add less or you add more, maybe you need to spend more money in different byproduct, but that is how you go most of the time about this. Now when your corn silage or some of the other forage get contaminated, it's a different story because the inclusion rate is not enough, right? You don't have another forage that you can replace that. Then we use these feed additive or binders, right? That has a tremendous potential, especially the third generation of binder. The binder has the combination. I think DSM has an outstanding product that the combination of the inorganic, organic, and the deactivator, right? Yeah. And because the deactivator, we know that Dawn mycotoxin is probably the most difficult to deal with in our system because it cannot be degraded. It does not absorb to any of the conventional binders. So you had to use a deactivator for that particular one. And what we look is the combination of mycotoxins. Usually when we run the test, we take TMR samples at the farm, send to the lab for testing. We run a panel of 10 mycotoxin, the most prevalent that we have for the region, right? And usually most companies report what they are finding, so we come up with the most prevalent. And we start with the TMR. And then based on the the output that we get, okay, we have 4 mycotoxin, 3 of them are in high concentration. Now it comes the second question, can we reduce inclusion of the things that we suspect that might be contaminated? Usually when it forages, the possibilities are very low, so we end up using this binder. And the benefits are usually, it's very sensitive to milk prices, but using the binder usually provide a good benefit because the losses are too big. You have losses in milk, you have losses in reproduction.
That's what I was wondering, because you have, of course, also loss in revenue of milk production, I think. So, but you're saying that weighs up. When you use the binder, then...
It's easier for the farmer to pay off a binder when the milk prices is good. But what I wonder for them is they need to think when the milk price is not good. You already stress the system, but it could be even worse not using it. So even it's more beneficial when the margin is lower because the losses are massive. And most is prevention at the farm level, and then the use of this additive is another alternative. A valid approach, and in particular in our effort has been lately more. We did a lot of work on lactating cows, but now it's more on prior to calving, because the manifestation of mycotoxin look like is other problem, but not mycotoxin. And the issue is that mycotoxin are pro-inflammatory and has the potential to trigger labor earlier. And we know that is a problem.
And a difficult problem to detect also. Also, not send when you're just a farmer, then to relate it to a mycotoxin contamination.
Exactly. So I always tell farmers to say, we collect a lot of data on the farm. But there is one piece of information that the farmer needs to see how their cows doing. Same as farmer will monitor pregnancy rate, milk yield, component, fat, protein. One marker that they need to add is the number of short gestation. And short gestation for Holstein cow is 255, 269. And you look at every month the proportion of cow. When your proportion is really high, you very likely are dealing with mycotoxins. Or it could be other, like summer, for example, is another that triggers short gestation. Twin pregnancy triggers short gestation. cow losing weight prior to calve triggers short gestation.
Yeah.
Right?
Yeah, but it's
So,
not like the normal focus that the farmers are
no,
looking at.
but it's
gestation
very
length.
sensitive, and they
Yeah.
will have a very nice pulse on the
Yeah.
farm, what is going on. So
Yeah.
the target should be no more than 12%.
Yeah. Yeah. Okay, so thank you. Thank you for the conversation and for being here and for your insights, sharing those with us. So thank you.
Thank you very much for the opportunity.
And thank you for watching Future Feed Talks. If you want to see more episodes or listen to our podcast, please click on the links below.